Welcome, everybody, to the Science from the Fringe podcast. I'm Professor Jay Bhattacharya, and today I'm delighted to have here with me Representative Mariannette Miller-Meeks, who is a member of Congress, but has a very interesting and unique history for a member of Congress as somebody who worked in public health for a very long time, is a physician, and has just a wealth of experience that she brings. Welcome to the show. Thank you for joining me. I'm really delighted to have you.
Well, thank you so much, Dr. Bhattacharya. It's a pleasure to meet with you. I knew you before I got into Congress and before COVID. At least I followed you on social media, and so your name was familiar to me, as was Dr. Marty Makari's. But to have a relationship beyond that has been just really delightful.
Well, I should tell listeners just a little bit about how we met, which is it's a little bit crazy and a little bit it's a painful memory in a little ways for me, because I was testifying in Congress, I think in November 2021, and one of the Democratic congressmen, a man named Raja Krishnamurthy, he accused me of killing his family in India, being a mouthpiece of the Chinese Communist Party or something. It was a surreal experience. But he didn't let me talk, and you got to interview me right after that, and you were so kind to me. I mean, the main thing you let me respond to this slander, and ever since then I knew I was just gonna love you. So that just have that as a thing. It's I think in Congress, if you get advice from outside, I always thought of it as like you're seeking advice from outside. You're not trying to like demolish people necessarily. Like what you're trying to do is you're trying to like say, here's what people think. And that's the spirit you brought to that conversation. Anyways, I really did appreciate that.
What's interesting is that I often say to people throughout the course of my career that remember small things that happen. So like whether it's a little note from a patient or something like that, that you'll need those things as you go along. I had forgotten about that until you said that. But I remember it because I was so mortified by those comments. They were personal attacks. They weren't based on the science. And that's what I found as a physician when I decided to run for office, was that people no longer saw me as the scientific knowledge or the resource or the credentials that I had. I now lacked those credentials and the authority and the truth because of the party that I was a member of. And I found that in medicine, and then even more so, in Congress. And so I just thought the attacks on you were unwarranted. They were unjustified. I could tell that you were, and we as physicians, and then I was a nurse before I was a physician. So you kind of get a sense, you're watching people's body language. I know that you thought it was uncalled for and unwarranted, and had no chance to respond. So for me, it was a human, compassionate thing to do, especially to a colleague, to offer them a time to rebut that. But that's what I have found in Congress. It's less about getting things done. I went into Congress to solve problems. That's what I've done my whole life. And it's sometimes less about solving problems for your state and the American people, and more about getting clicks or likes. So I don't know if that's new because of social media and 24-hour television, but certainly in my time in Congress, and I've seen that on both sides of the aisle.
So you mentioned your history, and it is a really unique history, I think, for people in Congress. So I'd love for you to tell my listeners exactly what that history is. Like you're actually a nurse, physician, but then also someone who played a really important role in public health as the head of IO Public Health. How did that career come about? Like, how did you move from being a doctor moving into public health? Obviously, you're passionate about it, but how just tell that story a little bit.
Well, first and foremost, I'm the fourth of 8 kids. My dad was enlisted Air Force, so we traveled around a lot. My mom had a GED, and she worked. So both my parents worked my entire life, supporting 8 kids. Neither of my parents had a college education, but they were both self-educated. They were very well-read. They were very scholarly. And, we knew that they wanted college for their children. They just didn't know how to navigate that coming from, a poor background. It was not unusual for my dad to pick up extra jobs on the weekend. And I remember being a teenager, where I would go to work with him at a pizza parlor on a Sunday morning. So it was 5 o'clock in the morning, and he didn't want me to clean with him. He just wanted me to keep him company, so to speak. So I came from a family people that worked very hard. They paid attention. They read the newspaper. They watched the news, at night on television. They were very well informed. I have no idea what their political party was. But when I was 15, I was burned in a kitchen fire. And prior to that, I had thought about going into education, going into teaching. I loved school. I did well in science and math. And so that seemed to me like a natural thing. And there weren't a lot of women. I mean, most of the women we saw were either in clerical work like my mother, or a medical records technician, or they were in education, or in nursing. And so when I was 15, I got burned in a kitchen fire. It was a very long hospitalization. It was very painful. And I decided that I wanted to become a doctor. And that was because of the physical therapist. I didn't have much relationship with the physician because we were in isolation. And so I got out of the hospital, 5 weeks later, and then told my parents I was going to become a doctor. They had no idea what to do with me and were very negative. And when you're a teenager and your parents are negative, you think that, they don't have faith in you. They don't think you're smart enough. They don't think you're capable enough. You have all these thoughts. And I just thought, if I stay around this negativity, I'll never be able to do this. So I literally charted a course for myself on how I was going to get to med school. So I left home at 16 because we had moved from Ohio back to Texas. It was a very small town, very small school. And I didn't want to remain there. We were always the outsiders. We lived on the wrong side of the tracks. We were military brats. And I just felt that I needed to leave. And so I left high school at 16, moved out of my parents' home, got a job, started at San Antonio Community College or junior college, and thought, well, if I got a degree in nursing, I'd be able to work at night and go to school. And so I started on a pathway to get a degree in nursing. And I enlisted in the Army when I was 18 because that seemed to be, I was familiar with the military. I was comfortable in the military. I liked the camaraderie in the military. I liked that you could be, to the best of your ability and an individual, but part of a team focused on a mission. So I enlisted in the military, which then ended up helping me to get my degree in nursing, worked at night, got a master's in education, and then ultimately got into medical school. And along the way, there were people who believed in me, who offered me an opportunity if I wanted to work hard enough to take that opportunity, and I did.
That's an amazing story. I would love to know what you wrote in your med school application essay.
Actually, I know exactly what I wrote and had no idea that being a victim and being a person of hardship was what would get me into medical school. But I actually wrote about exactly what I just said. The family I grew up in, and it was more how important medicine was to me that I was willing to go through this tremendous sacrifice to be able to go to medical school when no one in my family had even graduated or gone to college at that point in time. And so I came to Iowa to do my residency in ophthalmology. When I went to medical school, I thought I would be a family doctor in a small town. I thought I would deliver babies, treat high blood pressure, and fix hernias and take out appendixes. That's really what I thought, because I'd been in nursing. That's what I wanted to do. And it wasn't until I was in medical school and I was tutoring neuroscience, and I really liked neuro. I had been in both an emergency room nurse and an operating room nurse. I did the trauma, so we cracked a lot of chests when I was in the military. I loved trauma, so I thought I would do general surgery and maybe thoracic. And the person I had met when I was assigned at Walter Reed, who was an LP in E6, who is now my husband, has been my husband the past 41 years. And I was a lieutenant. He got a reprimand for dating me, but decided to stick with me. We just had
what is a reprimand worth having? I
suspect. I know. It's like, who gets a reprimand for dating and stays with that person? But he's a better part of the partnership. But he just, said, do you really want to do neuro if you want to get married and have kids? And so I said, well, ophthalmology, the eyes have a lot of the cranial nerves. That's like being neuro. And you can do surgery, you can do medicine, you can do all ages. I'll do ophthalmology. Loved it. Have loved being in ophthalmology. And that's when I came to Iowa. And then mostly remained in Iowa, other than having a stint on faculty at the University of Michigan and then at the University of Iowa, then into private practice, and ran for Congress unsuccessfully because I didn't like the government's interference with the doctor-patient relationship, our ability to be able to counsel our patients, to guide them, to make decisions with them. And so when I failed in my bid for Congress, Governor Branstad, who got elected, and he had won in some counties that I was representing, and I had overperformed. And so he asked me if I'd consider being the director of public health. And believe it or not, I had to call my friends, my physician friends, and say, do you think I could be the director of public health? Do you think I'm smart enough to be able to do that? And they all said, absolutely. And so I became the director of public health of the state of Iowa right after H1N1.
So around 2009, 2010 then?
So it was 2010 is when I got nominated and then confirmed in 2011. So 2011 to 2014.
So I mean, H1N1 was sort of the big pandemic really that hit the U.S. before COVID.
That's correct.
But you'd been in place as an Iowa health director for almost a decade when COVID hit. I have to say, I
was only in for 3.5 years and that was prior to COVID. So I was the director of public health from, typically people will stay one administration. You're an appointment by a governor.
Yeah.
And then you have to be confirmed by by the state's Senate in Iowa. So I was director I was nominated, appointed in 2011, and then after Governor Branstad became the governor again, I was in from 2011 to 2014. So that period of time, right after H1N1, and interestingly enough, we had some outbreaks that were foodborne outbreaks that we had to help with, cryptococcal. And so it was interesting because I was being interviewed and the reporter thought they were going to set me up and asked me this question, what keeps me up at night? What do I worry about? And I actually said in 2012 or 2013, I can't remember the year of the interview, but I said the thing that kept me up at night and that I was most worried about was that we would have a bacteria or a virus infection from abroad, from overseas, that we had not seen before, we did not know how to respond to, and that it would become a worldwide pandemic. So I actually talked about this when I was director of public health, that's the thing that kept me up at night.
I mean, I've been quite hard, I think, on public health as a field. I think because I believe that it really failed pretty fundamentally to do its job during the pandemic. But not everybody failed. I mean, you can point to examples from abroad. For instance, Anders Tegnell, who directed the Swedish response. And I also point to you. Can you describe 2020? You're in public health, then what sorts of what were you seeing? What sorts of things were you were you thinking as the country went through this and the world went through this huge conflagration, essentially?
So what was interesting was that I was back in private practice, but then I was running for Congress. So I had left my practice. I had been able to recruit some other ophthalmologists to come into practice so I could leave my patients in good hands. And so I was being asked to defend both President Trump's policies in 2020 as well as Governor Reynolds, our governor's policies in 2020. So it's fascinating to look at that. I was in the state Senate. At this time, I was a state senator and was talking about the Diamond Princess cruise and how that let us know what the actual infection mortality rate was, the infection fatality rate, which we can look back to that now, and it actually does predict accurately what the infection fatality rate was, who would get ill. I was tracking from China, had watched what had happened, both in Wuhan over the Chinese New Year, what was happening out of Taiwan accurately predicting that there was human-to-human transmission. I was following South Korea and what South Korea was doing. I was also reading things at the CDC website, which referred me to the NIH on hydroxychloroquine and SARS, SARS and how hydroxychloroquine impacted SARS. I was
SARS-1, that's the first one in 2003.
That's exactly right. Was reading things about vitamin D because I had doctor friends who were different ethnic groups, and they were talking about, what they did. And whenever I campaign, I always increase my vitamin C uptake. So given what I had read at both CDC and NIH, I went ahead and started vitamin C, but then vitamin D and zinc. And so later on, as you know, we would discharge people from the hospital after being hospitalized for COVID on that regimen to help their immune system. So I think it's fascinating where there were failures, where things we could have done better in the pandemic. And I think in Iowa, at least, our local county public health agencies performed tremendously. They were just exceptional at what they did, how they responded, how they were trying to get people both tested, diagnosed, vaccinated, and then into treatment.
It was interesting to watch as an academic. Like I do research primarily. I'm an MD, but my job is research and teaching. But I would get calls from my friends who were doctors on the front line, tremendously frustrated that they were getting very little guidance from the NIH, from the CDC about what to do for patients that they had essentially no treatment. But it was worse, though. They were also getting pushback, being told that they weren't even allowed to try things out for a disease that was new. And then they started to people would tell me that they were afraid they would lose their license. What happened in the mind of public health to say, look, we have a new disease out there. We're not going to allow experimentation by doctors, skilled doctors, experienced doctors, taking care of their patients who were in many cases back then dying.
I think that's one of the tremendous tragedies of COVID, and I'm going to say of our public health and medical community. And I'm going to say public health because this straddles two administrations, both President Trump, the tail end of President Trump's administration, but mostly under the Biden administration, and really ramped up and became even more exaggerated under the Biden administration. And that is, when you have a novel disease, there is no treatment or cure. So what were we telling people in 2020? And I wrote an article on this in the end of April of 2020, and it got published, I think, in the Washington Examiner. And I talked about how we needed to open hospitals and clinics now, that doctors, healthcare providers knew how to treat infectious diseases, that if we did not open clinics up and medical facilities up, that what we were going to see was an increase in cardiovascular incidents, whether it was strokes, heart attacks, diabetes, worsening diabetes. We were going to see people die from cancer, either not treating cancer or developing cancer because they're not getting screened. I correctly predicted that we would see increased anxiety, depression, and suicide, and that we would see increased drug use, addictive behavior, and deaths from drug overdoses. All of those things happened because we as a medical community weren't treating people because we were, listening to other voices. And so voices that said, we knew that who was most vulnerable. There were several truths that came from the Chinese Communist Party. One was that children weren't affected, and two, that the elderly and people with medical diseases were the most vulnerable. We knew from the Diamond Princess cruise, 700 people, 7 deaths. So we knew those kinds of things. And people didn't feel that they could push back. When you're telling people to come to the ER, get tested, or go get tested, and then if they go to the ER, you have COVID, okay, go back home until your breathing is your O2 rate. We were telling people, we can't treat you, we can't do anything for you, so you can go home and die. I mean, literally, rather than try something that may have been effective. I mean, we had governors of states, Governor Whitmer in Michigan, if I remember correctly, Governor Whitmer in Michigan, and then the governor, Sisolak of Nevada, who said that they would remove licenses of people who prescribed hydroxychloroquine. As an ophthalmologist, I've had patients on I've got 30 years of experience with hydroxychloroquine. I saw doctors on television saying how horrible a drug it was, how it was not safe. And I'm going, this is a medication we have used, very little side effects. In 30 years, I've taken one person off. Why can't we try hydroxychloroquine if we have nothing else to give individuals, no other therapeutics? And, to try an off-label use of an approved drug that was inexpensive, that was cheap. And so it was this rhetoric that we're hearing. And you're absolutely correct. People's livelihood, their licenses were on the line. I was reported twice to the Board of Medicine in Iowa during that time for COVID misinformation. And what was the misinformation? We should not have a vaccine mandate, that it should be between doctors and patients, determining their risk profile and infection-acquired immunity. Why are we vaccinating and mandating people who have had verified disease? Why are we mandating that they get vaccinated? And this even happened to me in 2023 with the house attending physician when I was checking my antibodies, and my antibodies were still very high. And then he said, but we still want you to get vaccinated, get boosted. And I go, why do I need to get vaccinated? Well, we still recommend it. And I go, why are you recommending it? The purpose of a vaccine is to confer immunity. If you have immunity, you don't need to get vaccinated. And why are we wasting precious vaccines that are very expensive on people who don't need to be vaccinated because they already have immunity and they're not at risk to anyone?
I mean, it was really disheartening because, there'd be study after study that would come out, but it looked like public health wasn't interested in what the scientific evidence was saying, right? That like certainly on immunity after COVID recovery, on the waning of vaccine efficacy, and on whether school closures were a good idea, ignoring lockdown harms. I mean, what you described is what it was, the inevitable outcome of people essentially saying the only thing that matters to health is whether you get COVID, not all the other things that people that have as important health priorities. It was a lot of people that I thought knew better essentially turned a blind eye to all of that because they put it up all on the altar of controlling COVID as if that were the only public health goal that mattered. And ultimately what public health adopted as its primary philosophy was that it's good to treat our neighbor as a biohazard.
Yeah.
And it was the antithesis of what I thought public health was about. And yet that's exactly...
And report your neighbor and report the college student if they want to go out and get together, even though they're at no risk, and I think it was when I first read the Great Barrington Declaration, I'm reading this and I had already told our state in March of 2020, and they said, we're looking at closing down schools. And I go, why would you close down schools? I go, children aren't at risk. And at that time, we had an article from the Journal of Pediatrics that said children didn't transmit because they had such a good immune system. They weren't the ones that were infecting elderly people. It wasn't until the Delta variant that we really saw transmission among children. But the CDC went out of its way. We had, as the Doctors Caucus in Congress, we had sent letters to the FDA and CDC to look at real-world evidence from Israel and other countries on spreading out the duration of the first and second vaccinations on Pfizer or on Moderna, that they should be spread out, that you needed a longer horizon instead of 4 weeks. We talked about looking at the real-world evidence coming out of Sweden and what Sweden was doing. And as you know, Sweden was vilified for its policies, that they didn't have lockdowns. It was voluntary. They didn't mandate vaccinations. And we also know in Europe, they didn't close schools. And so why wasn't our CDC looking at real-world evidence? So not only do you have to look at research and be a research institution, but you have to be able to confer that research into a message, into real-life public health strategies and tactics and messages, and they weren't doing any of that. Remember, it was the CDC that messed up the first testing. We had over a 6-week delay, but we already had a test that was already developed at the University of Washington. So why does the test have to come from the CDC? Why can't we use what we have in our research communities, what we have in our public-private partnerships and our private labs? There are so many things that I think went wrong that could have gone better. And to your point, we could have protected the most vulnerable and not shut down an economy, not led to all of these other consequences. Was there significant mortality among the most vulnerable, the elderly and people? Yes, there was. But there's also a mortality. There is also a risk to young people, to children who were not in school. There wasn't mandatory reporting. There wasn't reporting for domestic abuse. Children who didn't get medications. Children who had no access or had limited access to the internet for studying. The community that exists in a school system, the numbers of youth suicide. Do you know why I brought this up in a hearing? In one of our first hearings when they were doing the COVID money, and I had an amendment for $2 billion to go to mental health for kindergarten to 12th grade, and then for undergraduate school. Both of those amendments were voted down by all the Democrats. But what was most important, I said at the time, Nevada has opened up its school system. Why did they open its schools? Because from March 16th of 2020 to June 30th of 2020, there were 6 youth suicides. From June 30th of 2020 to December, there were 8. They had doubled or tripled. There were 18. I don't remember the number, but they were forced to open its school because the rate of youth suicide was monumentally higher. Are we supposed to lose elementary school students and middle school and high school students because of suicide to protect those people that we knew were vulnerable and could have remained at home and who were given the first opportunities to be vaccinated? So when you say that when you're talking about the only risk wasn't the death from COVID, it's all of these other things. The rate of suicide, 18 to 45-year-olds, drug overdoses, vastly exceeded deaths in California and in San Francisco than it did deaths from COVID.
You brought up testing, and I mean you're absolutely right about all of that. I mean the blindness to the harms done to the less vulnerable, but then also the failure to actually protect the vulnerable, right? So take the testing, right? So it took forever for the United States to adopt at-home testing.
Yes.
What public health decided was that they needed to know every single case. They're going to contact trace. Essentially, they wanted to turn this the public health into this authoritarian thing, as opposed to something to empower people to take control of their own health. Right. So imagine if we'd had at-home tests approved very, very early, then you could check it before you go visit grandma. If you check yourself, and if you're negative, then you go visit. I mean, it would have been a tool for empowerment, and rather than isolating grandma unnecessarily. You could have those kinds of visits, knowing that you're having some assurance that you weren't carrying the virus, rather than a test that you have to go send to some lab. You have to go to a doctor. You have to send to a lab. It takes 3 days before you get it, and then public health knows about it. And a lot of people distrust government, so they don't want to do that. It was amazing to see the authoritarian tendencies of public health, which I always thought was the worst parts of public health, come out to the front. And then used to suppress any discussion, like with this sort of censorship push that ran contrary to it, as if somehow anyone questioning public health's questionable advice was somehow doing some damage to the American population.
Well, boy, that's rich. There's so much in there that you could work off of, and one is the censorship and what happened, and why did that happen? Why do doctors who have this foundation of knowledge, who have the ability to dissect through information, I mean, that's what we're trained to do, to gather information, whether it's verbal, whether it's written, whether it's testing, whether it's imaging, to gather information from all of these sources, then to review all of that information, and then to make an assessment, and then to make a plan. That's what we're trained to do. So where in all of this did we somehow forget about doing that? The authoritarianism, it was absolutely authoritarian. I can tell you that local public health people often did not agree with what was being done. We didn't know that there was early on. And so early on, your policies may be different than they are later on. But we didn't know that there was asymptomatic carriers. But then it was because, to your point, your neighbor, it could be an asymptomatic carrier. So we have to protect you from the asymptomatic carrier. Well, if you've been vaccinated or if you've had the disease, you've conferred immunity. So why are you worried about that person? And if you wanted to protect yourself, if you were that frightened of the disease, then remain home and isolate yourself. But the other thing to your point is that, and I had this issue when I was in public health, there was something my staff wanted to do is very important. And so I had to say to them, credibility and trust is all we have in public health. The ends never justify, the means never, you can't justify that because you have the ability to lock people in their homes through the force of law. So at all junctures, our trust, our credibility is paramount. We should be truthful. We should be transparent. We should be honest with people and help to guide them to a decision. We could have said that about masks. A regular mask is about 30% effective or so. We kind of knew that. We're not sure the size of these particles or aerosolization, but we don't want you to go out and get a KN95 mask because we don't have enough for healthcare personnel. I mean, we could have been that honest with individuals. We knew that outside you were okay. But yet we're mandating masks outdoors and telling people not to go outdoors or not to go outdoors by themselves. You had the governor of, is it Kentucky, who wouldn't allow people to go to a drive-in mass sitting in their own cars. I mean, that stuff, or even worse, remember the demonstrations in 2020, Black Lives Matters demonstrations. And what did the public health community say? You can't go to a Trump rally. You can't go outdoors. You can't go to an outdoor concert. Gavin Newsom, you can't be on the beach or in the ocean by yourselves in California. But because racial injustice and police brutality is so important, the virus isn't going to transmit if you go to a Black Lives Matter rally. I mean, that kind of stuff, it's mind-boggling, and it was so hurtful to the trust in the public health community on top of all of the other issues they had. And again, I would say when I would talk to our county public health nurses and doctors, they're saying we have to follow what guidance we're getting, but we don't necessarily agree with it.
Yeah, I mean, I remember that moment specifically as it's quite shocking, right? So they told people to stay home and isolate at scale. They cracked down on anti-lockdown protests. But when the Black Lives Matter protests happened, because so many public health officials, I mean, for them, that was the most important issue, right? Avoidance of racism, even more important than their professional commitments to talk about avoidance of a virus or protection against a virus. So so when they came down in favor of the Black Lives Matter protest, essentially authorizing it from a public health perspective, so many people lost trust in the public health establishment. They thought, okay, they're not reflecting their professional scientific opinions. They're just reflecting their political opinions to me. And that's something that public health should never do.
100% correct. And it's why people felt that the COVID response in the pandemic had become politicized. The same with, you had the military ship, the Navy ship that had a COVID infection, but yet we were mandating in our military and sending people out, discharging people from the military if they declined to get vaccinated. The CDC, even in our conversations, you can go back to those hearings and the papers they published denying that there was an increased risk of myocarditis and pericarditis, especially in young men that were vaccinated versus COVID. They said on numerous occasions that the risk was the same if you had the disease versus if you were vaccinated. The risk was not the same, and we know that, and more of this information is coming out now. But the damage has been done to public health, and unfortunately, I don't think the new CDC director is going to be able to recover that damage because they're still pushing the same message that they did before. It wasn't a lack of communication messaging. It's that, it was an authoritarian dictate that was politicized, and they were using that in an authoritarian manner to force people to do something and not really truly following the science, not allowing therapeutics that may be helpful, may not be helpful, but let's do this study. Let's allow physicians to do that. Let's allow them to use their best knowledge, allow people to have a discussion with their provider, their physician, on whether or not they should be vaccinated. And, when you had two of the most premier vaccine experts leave the FDA, resign from the FDA board over the mandate for young people under age 18 and then under age 5 to be vaccinated, that should have been a wake-up call to the administration.
Yeah, it's Gruber and Krauss. They were like the evaluators for the COVID boosters, and they resigned because they were essentially feeling political pressure to approve the boosters, even though the data did not actually justify the approval at that time. I mean, it's just shocking. Actually, this brings us to a point. And this is what I always wanted to ask you: is what can you do? What have you seen in Congress that can be done, and also broadly what can be done to reform the CDC and the public health establishment of the U.S. Because I believe very strongly that public health is important for the health of the public, and having a public health infrastructure that has completely failed, and as a result the public distrust it, is actually not good. Obviously not good for public health, but it's also not good for the public. So to me, reform is the most important thing. Like absolutely, we have to catalog the failures and then learn from them, kind of like after a plane crashes. But then what's next? What have you learned? And how do we go about making a public health infrastructure that's worthy of trust?
Well, I think it's interesting that you mentioned plane crashes. And so there's this whole big process that happens with the plane crash in order to prevent it from happening again. And I can tell you in my 24 years in the military, both, active duty and reserve, both as a nurse and a doctor, you do an after action report. So when we do our training exercises, when we do our drills, for our mass cal drills, you're doing that to learn from that, to find out where your weaknesses are and where your strengths are. And so one of the first things we did is that I was on the select subcommittee in the coronavirus pandemic. That's where you testified. And so that was set up in order by the majority party at that time, the Democrats, in order to penalize and criticize President Trump and his response to COVID. And so I was with it the first 2 years when we were in the minority. And so the Republicans, if they got the majority in 2022, were going to shut down the committee. And I staunchly advocated to Representative Scalise and to McCarthy and to all of our leadership, please do not get rid of this committee. I know why it was set up, but this select subcommittee is so critically important because I can tell you from all of my time in the military and public health, the past response becomes the precedent for the future. And if we do nothing to challenge them on masking, on 6 feet distancing, on school closures, if we do nothing to talk about infection-acquired immunity, I had a physician on one of our panels say, well, we vaccinate people all the time who have had disease like shingles. You and I both know we do not vaccinate children with shingles vaccine 2 weeks after they've had chickenpox. It is not done. It is an adult vaccination for when you've had chickenpox as a child. And so if we didn't keep the select subcommittee on the coronavirus crisis, then everything that had happened before was going to become true and into the public record. And so the first step was keeping the select subcommittee on the coronavirus. Why? Because we got Fauci to admit that there wasn't any scientific evidence for 6 feet distancing. There wasn't any scientific evidence for closing schools. Walensky and the CDC, they did not want to admit that. We were able through testimony, through, FOIA to get that information. We were able to, reassert that that the lab leak theory was in fact a true theory and is probably the most likely source rather than in nature through a wet lab. And as you know, we still don't have who's the host animal?
Raccoon dogs? I don't know.
We don't have a host animal, but we did with MERS, camels, and we did with SARS.
Bats, yeah.
Bats. So we did with other viruses that have led to worldwide infections, but we don't with COVID, SARS-CoV-2.
No, I think that's been very, very important. I completely agree with you that to have a committee of the House trying to ask honest questions. I still think there's quite a long way to go, but a lot of progress has been made relative to 2022. Yeah,
we've got Peter Daszak. We've got him to lose funding from NIH and grants, and also pointed to the NIH not doing its due diligence and oversight of grantees or sub-grantees. So all of those things are very important. Talking about the vaccine mandate, talking about adverse outcomes and side effects in young people, and where the CDC needed to be more transparent about adverse outcomes instead of trying to have a particular narrative. And so I think, first and foremost, I think keeping the select subcommittee was so crucial for us in our understanding on how to respond to the next pandemic. And then the other things are having the proper oversight. So we had oversight on the Oversight Committee, on Judiciary, and then the select subcommittee, and then on Energy and Commerce. All of those committees doing oversight really drove home, and we got to have not just closed-door testimony from Dr. Fauci, but actually had him come before the committee, and Governor Cuomo as well. And so I think that oversight function of Congress is critically important and cannot be minimized.
Yeah,
the next is CDC reform, and I think your comments on CDC reform, The CDC, when we became so good at vaccinations for childhood diseases, which you and I, we're not anti-vaccination. Now, there are concerns I have with the numbers of vaccinations, who we're recommending them to, how early and what ages that we recommend, and the numbers of vaccines in a single inoculation. I have lots of concerns about that.
I have to say about that is that that's a pro-vax point of view. Like normally you would go back go reevaluate the evidence all the time.
Absolutely.
I've worked with the FDA on COVID on vaccine evaluation, and that's normal part of being a responsible public health agency, going back, reviewing the evidence, asking for better evidence when it's needed, making revisions to recommendations. That's not an anti-vax position. That is a pro-vax position.
Correct. And so when it comes to I think that the CDC and public health had such success with polio, measles, whooping cough, that, these childhood diseases that are deadly, and there's a high mortality rate. So there's high infectiousness and high mortality rate, that we've been successful at those. And so as we became successful, people thought there was less need for public health, so expanded to the CDC and P. So Centers for Disease Control and Prevention. And I have a Democrat friend who asked me that when I became the director of public health, they're doing too much. They're doing all of this stuff. Why should they be doing all of this? So they became like a de facto health agency and I'm not saying that it's not valuable to have heart disease, to have cancer screening, all of that. But we sort of lost that focus and became a research arm. But the CDC is not just a research arm. They're the guidance that we need. They have to be able to take real world evidence and put that into public health messaging and public health strategy. They have to be able to work with both their private entities, research facilities, whether they're at universities or whether they're laboratories. They need to bring in all of that information. They need to be able to work with other countries and see what other countries are doing, and then translate and translational research into a public health, program, tactic, or message. And that's one of the things that they have not done well. And they have not done well in working with entities in the private sector as well. So that continues into our strategic national stockpiles, which there's a whole lot of stuff we can get into, but absolutely the CDC needs to be reformed. And it's not just, how many people are in the public information office and does communications. It really needs to be an entity that can respond, can pivot, respond rapidly. It has to be able to respond rapidly, and it has to be able to be deployed.
All that sounds very, very reasonable. What puzzles me though is that as you were talking, I was thinking to myself, you're a Republican House member, but the ideas you're putting forward, I don't hear any partisanship in that. It really ought to be a bipartisan. Everybody benefits from having a CDC that's working properly. Why has it been so hard to get the Democratic Party to sign on to these kinds of ideas? Because they're not, as I said, not inherently partisan one way or the other. Public health needs to work for all Americans if it's going to work for anybody.
Well, I think part of it is that we weaponized federal agencies. As you said, people were being censored. People were being reported to the Board of Medicine. Doctors felt, and not only doctors, nurses felt that they were sidelined and that they couldn't speak out, that they were going to lose their job. And they did lose their job. People in the military lost their job if they questioned whether or not a vaccine mandate was appropriate or whether they should be vaccinated. And as a military veteran, I was asked on more than one occasion, both on the Veterans Committee as well as on the select subcommittee of the coronavirus pandemic, where you were in the military, you had to be vaccinated. And so what's wrong with this, mandating the COVID-19 vaccine? I said, it's one thing to be vaccinated when you're being deployed to an area where something is endemic. And you're given, you're allowed to refuse the vaccine or decline it if you have an allergy or if you have a medical condition. But there is this conversation that exists, and you know why you have to be vaccinated. When it came to COVID, there was no consideration. Back to your point, the risk-benefit analysis, there was no consideration. And I considered the COVID-19 vaccine mandate in the military to be an unlawful order because it didn't look at anybody's individual status. They were slow to grant any religious and very few religious exemptions were provided or medical exemptions. It was just a mandate, and all of our military leaders in command enforced the mandate because that's what the Biden administration called for.
That was particularly bad because there was so many young men, right? It's young men specifically that higher risks of myocarditis, and of course, young men and women together are much lower risk of dying from COVID than, for instance, the flu.
Precisely, they were at low risk. So instead of protecting the people that potentially, could die or have, very serious medical harm, if they got COVID, what we did instead was to penalize those people who were at minimal to no risk of getting the disease or having serious consequences or being hospitalized. Right. And it was just backwards from what our typical public health response would be.
Yeah, I think I read somewhere that it's like 8,400 people in the military were discharged because of the COVID vaccine mandate. And that just strikes me as so wrong-headed. And I think at this point, I think the DoD is regretting it. Like they're trying to get back some of these experienced military personnel, and just it made no sense at the time. And it's a lot of people in the military reached out to me at the time asking for help with this. And I was trying my best with as an expert witness in a whole bunch of these anti-mandate cases. But ultimately, I think it was just a huge mistake by the Biden administration to do that.
It was a huge mistake. It was a huge mistake on our military not to go back to the Biden administration, ask for risk-benefit, protocols, which they should have had at the time. And as we know now, recruitment is down, and so we don't have the young men and women. And again, it goes back to, most people in the military are pretty healthy. You're not dealing with people that are, over age 65 and who have complex medical conditions. And so therefore, the risk that you were going to create harm to other service members, I think, was very low. But the risk for being vaccinated as a young person, especially a young man, was significantly high. And so it has affected our ability to recruit, I think, when people saw what was happening. And we also shed people from the military that we need in the military. So it puts us at a national security risk as well.
Well, I want to thank you for your time. It's been a great pleasure to talk with you, and I also want to wish you all the best. Of course, in your reelection campaign, but primarily in your work, which will extend no matter what happens on Tuesday, to reforming public health. I'm really glad to have you working toward that very worthy goal.
Well, Dr. Bhattacharya, I would say that throughout the pandemic and even through this, you have been a voice of reason. So we're very lucky to have you and, Dr. McCary and Dr. Coldroff. There's so many names I could say, and I'm going to miss some. But we really need those people, a voice of reason. And I think you alluded to this early on, and that is science and medicine isn't consensus. We need debate. We need different voices. I will point to, remember peptic ulcer disease? I was a nurse in the Army where we were removing people's stomachs to treat peptic ulcer disease. You were type A personality, you were perfectionistic, obsessive compulsive, high executive functioning. We were removing people's stomachs. And two Australian scientist physicians postulated that it was a bacteria. It took 20 years, over 20 years, for the medical community to acknowledge that. And now we know Helicobacter pylori as the cause of peptic ulcer disease. How many lives were ruined because we were fixated on it being a certain type of thing instead of being willing to have debate, conversations, willing to go at it. That's what we need, robust debate in medicine. We shouldn't be censoring information. If you think there is misinformation or disinformation, the answer to that is always more information, not less information.
Well, with that last word, which I entirely agree with, thank you for coming on and talking with me. This has been Professor Jay Bhattacharya talking with Representative Mariannette Miller-Meeks on Science from the Fringe. Till next time.